You're tuning in to the O&P Check-in, an SPS podcast. I'm Brendan Erickson, a regional sales manager at SPS.
And my name is Jackie Green, a marketing specialist at SPS. This show brings you the latest happenings in the O&P industry. We're unpacking trends and news from this tight-knit orthotics and prosthetics community.
Thank you for joining us. Let's get started.
Step into a new era of prosthetic technology with fiberglass MetaCore from Willowwood. Crafted on the innovative Meta Unibody platform, unparalleled stability and natural rollover across the various terrains is now available to fiberglass users. Experience the reduced weight and enhanced dynamic response the Meta family is known for. Redefine your mobility with fiberglass MetaCore, available now through SPS. The SPS Clinical Education Days registration is now available for the first half of 2024. In this free in-person event, hear from SPS Clinical Services team and experts from Bulldog Tools Inc., Click Medical, and Cypress Adaptive as they delve into a wide range of relevant topics to help you enhance your clinical workflow and improve patient outcomes. Follow the link in our show notes to learn more, or select the resources tab on spsco.com.
Hello, listeners. This week, we have the pleasure of speaking with Manager of Public Engagement at the American Orthotic and Prosthetic Association, Nicole Kuilen, as well as the Manager of State and Federal Advocacy, Sam Miller. So welcome, Nicole and Sam. Thanks for joining us today.
Back again. We love having you guys back.
Yeah, thanks for having us, Jackie and Brendan.
Yes, thanks for having us on again.
So thank you so much for joining us once again on the pod. And the last time we had either of you on, I think, was in 2022, but this is the first time we're having you both on together in one episode, right? So with the 2024 AOPA Policy Forum just around the corner, we wanted to get a sneak peek into AOPA's advocacy efforts and what we can expect this year on Capitol Hill. So could you guys start us off by sharing what the Policy Forum is about for our listeners who maybe have not heard of it before?
Yeah, absolutely. So Policy Forum is AOPA's annual Congressional Fly-In Day. This is where our members and the patients they serve travel to Washington, D.C. for 2 days of events. The first day is kind of the learning day, the education day. Attendees learn about AOPA's federal priorities and how to be effective advocates. And then on the second day, they travel to Capitol Hill itself, where they get to meet with legislators and their staff, and they discuss issues affecting the O&P community at the federal level.
That's awesome. And so what will be the focus of this year's Policy Forum?
So the main focus of the Policy Forum this year is the Medicare, Orthotics, and Prosthetics Patient-Centered Care Act. This is legislation that AOPA has worked to introduce during the past few legislative sessions, and we're looking to continue to push it forward this year.
That's awesome. And so is this right? The Medicare, Orthotic, and Prosthetic Patient-Centered Care Act. Could you go a little bit in depth? And then do you guys actually get to go to the White House?
So, yeah, we're not going to the White House itself. I don't really spend a lot of time in like the Capitol Rotunda either, unfortunately. It's mostly the 2 or 3 office buildings on either side of the Capitol where a lot of the staffers do the majority of their work. But it's still pretty cool. It's still really awesome to see the kind of the architecture in DC near the Capitol. But I can kind of go into the bill a little bit, if that's all right.
That's the important stuff.
I'll try to keep it like high level, but the bill has 3 provisions. The first is a prohibition on drop shipping for custom orthoses. So you might have seen late night ads that say something like, do you have neck pain? Do you have back pain? Call this number and you'll receive a free brace from Medicare. These are really predatory ads that prey on vulnerable seniors and Medicare patients. They allow these fraudulent companies to send really complex devices in the mail. And this, it eliminates this clinical oversight that's needed for these complex devices. And so what ends up happening is these devices are not used properly, which could potentially lead to further injury, or, they're shoved in a closet and never used at all. And meanwhile, Medicare is on the hook for all of this money for this expensive device. So hopefully by prohibiting this practice, we'll be able to allow for that clinical care that's needed to happen, but it also will prevent a lot of fraud and a lot of wasteful spending in the Medicare system.
Just a quick clarification on that. If somebody does sign up for that and receives something via the mail, does that prohibit them from getting an actual device when they get it because they've kind of used their allotment for that type of device?
Yeah, so you're right on the money. So that's actually that's the third provision of the bill, which eliminates reasonable useful lifetime restrictions for those same types of custom orthoses. So right now there is that kind of 3 to 5 year time limit for custom orthoses, and that doesn't really take into account changes in the patient's condition or the wear and tear that these devices undergo through repeated daily use. And so if you are able to remove those requirements or those lifetime restrictions, patients will be able to get the care that they need when they need it instead of having their benefit used up in the way that would happen if they received one of those devices.
Yeah, I mean, that truly is predatory. I mean, they're trying to just, snatch away an opportunity. And gosh, I hope this passes because that just seems awful.
No, exactly. And it's, that's the DOJ has had a few busts in the past a couple of years that are to the hundreds of millions or even billions of dollars. So hopefully we're seeing a lot of savings from, reducing that. And also we're getting better patient outcomes as well. But that's kind of provision 1 and provision 3. The second provision is an exemption for O&P practitioners from requiring a competitive bidding license to provide off-the-shelf orthoses. So that's kind of a mouthful, but I can give an example to kind of illustrate that point. If I am a clinician and I do not have a competitive bidding license, and a patient walks in who uses a prosthesis on one side of their body, but needs an off-the-shelf orthosis on the other side of their body as a stabilization, because I don't have that license, I would need to send that patient, to another clinic that does have a license in order to receive that device. And that just adds another barrier to care, especially with, rural or underserved communities. That might mean traveling quite a bit or, it just makes it harder for patients to get what they need. And so hopefully we can remove that loophole and allow for O&P practitioners to essentially provide all the care that a patient needs in one place. And this provision doesn't cost any extra money because those devices would be provided at the same level as the competitive bidding rate. So it's pretty much just revenue neutral. Yeah, it's definitely a fair assumption. And this exemption's already in place for allied health professionals like occupational therapists and physical therapists. So it's really kind of a no-brainer to just add O&P practitioners to this list and make sure that this it's kind of closing a loophole, essentially, what this provision is doing.
It's just interesting, the legal verbiage and how limiting it can be and how much it ends up costing the government on one side, but also the incredibly negative effect it can have on patient outcome and patient cares at the same time. So it's fun to see when policies can be adjusted and improve both more effective spending and patient care. Like, that's a win-win for everyone, right?
Exactly. And we actually found out, we conducted kind of an independent study on the fiscal impact of the bill, and we found that it would save the Medicare program $60 million over the next decade. So it really is a win-win for everybody, for more fiscally minded legislators that want to save money, there's something there for them. And for those for whom patient care and patient access is paramount, there's something for them as well. So it's really got something for everybody.
What's your confidence level right now? I mean, is this like a slam dunk home run? You guys are going to go in and just get it signed?
I mean, in the current congressional environment, things are a little polarized, so it's always tough to predict something like that. And hopefully, like a lot of other bills in Congress, we'd likely need to attach the bill to a kind of a legislative vehicle, spending package that needs to be passed. But I think that this bill has been gaining a lot of momentum in comparison to where it was in the last Congress. So the House version of the bill has been around for about 9 months. And in that time, it has amassed 35 co-sponsors. And in the same time span during the last Congress, the previous version of the bill only had about 14 at this time. So you can tell there's a lot more movement, and it's kind of picking up momentum.
Yes, great momentum.
Yeah. Like you're saying, it's kind of a win-win for wherever you fall on the line kind of thing. There's, we're saving money and we're improving quality of life.
Absolutely.
So
it really helps with the messaging too.
Yeah, everybody wins.
Yeah, exactly.
No, that's awesome. Okay, so switching gears a little bit to another very important initiative. So Nicole, we previously had you on to talk about So Kids Can Move initiative. And as I'm sure a lot of people have seen, some things have changed a little bit with the initiative. So can you just catch us up on what's happening and how has it expanded? And I think I just saw some headlines the other day, pictures of you guys on social media. So what's happening in that world?
Yeah, absolutely. Well, a lot has changed since May 2022 when we first launched So Kids Can Move, and we're seeing just an incredible wave of momentum and really this initiative that's honestly sweeping the nation in many ways. So kind of going back to May 2022 is when we first launched So Kids Can Move as a result of learning that in Maine, an advocate there, Jordan Simpson, along with her representative, Colleen Madigan, had passed the first legislation in the country requiring insurance companies to cover prosthetic care for physical activity for children 18 and under. And after we learned about that, and at the same time, we had already been working on internally at AOPA, along with the National Association for the Advancement of Orthotics and Prosthetics, on a general policy initiative to define physical activity as medically necessary. And, that was kind of a very general proposal and kind of project that we were working on with them and hadn't really found the policy solution yet. But once we heard about what Maine had done, took that and decided, hey, let's run this as a pilot and see what we can do with this across the country. So we took what Maine had created as model legislation, branded it as So Kids Can Move, and started putting together a ton of resources and education and getting the word out across the states. And as we started to develop that, we just saw an incredible interest from states to take this on as well. And in many ways, this was a really smart policy solution that Jordan and Representative Madigan were able to create, because what it did was build on 20 plus years of an already established movement, which was known as insurance fairness. And 21 states had already passed insurance fairness laws. And so Maine was one of those states. And that insurance fairness legislation requires insurance companies to cover orthotic and prosthetic care at the same level as Medicare. And so they were able to take an already existing law, tweak it a little bit, and add the physical activity component. And for legislators, that's oftentimes a slam dunk to have something that's already in existence and just modifying it a little bit. So we started to see that other states that already had these insurance fairness laws were able to start, taking the model legislation, adding that to theirs and getting it through. But what we were excited to see is that all of these other states that started coming on board and introducing this legislation, they wanted to do it for all ages and not just for children. And so last year we saw incredible success where we had 4 states enact legislation after Maine, which included New Mexico, Colorado, Illinois, and Arkansas. So now we've got 5 states across the country that have enacted this legislation. And as a result of them deciding to move for all ages and polling all of our advocates that we've been able to recruit since then, which we're now spanning over 35 plus states that are actually part of this movement and are actively building coalitions around this, we decided to move towards So Everybody Can Move. And now that is the new name of the initiative. We just launched a new website, soeverybodycanmove.org, and we've got 8 states this year in 2024 that have introduced legislation, which include Florida, Indiana, Maryland, Massachusetts, Minnesota, Nebraska, New Hampshire, New Jersey, and then we've got 2 other states, Oregon and Tennessee, Oregon and Nebraska. Tennessee is another state that had introduced the So Everybody Can Move legislation, but 2 additional states that have decided to go after insurance fairness to have kind of foundational legislation that could then take on So Everybody Can Move legislation in the future. So we're just seeing just incredible amount of momentum and interest in this. And just this past week, we had a phone call with Alaska. The week before, a phone call with Hawaii. We're getting some of these states that have not, previously been involved in these types of policymaking campaigns. It's been incredible to see that.
Holy cow. I mean, it's so awesome to see so many states join on, and it seems like you guys have just like the right recipe, right? You've got an actual plan. You go after the insurance fairness. If they don't have that, go for that first, and then you can modify it to, so everybody can move. And I always say it's always good to have a good plan because then you can execute it. And it sounds like you guys have done that. Are there other state initiatives that you're aware of that have picked up a bunch of steam as well?
I can kind of speak to that a little bit. So Nicole already brought up insurance fairness. That's definitely something that is going on in several states. But another issue that we've seen that's really important is kind of Medicaid coverage and reimbursement, which is definitely on the top of mind for a lot of providers. But over the past couple of years, we've had significant increases to Medicaid fee schedules in a few states. It's Arkansas, Illinois, Indiana, Kansas, and New York. And this is all due to the hard work of O&P advocates on the ground in these states. In particular, I think Arkansas is a really good example of this. They set their reimbursement to 90% of the 2023 Medicare fee schedule, and that is the first increase that they've had since 2006. And kind of on a similar note, there's this issue of Medicaid MCO parity that's also been kind of coming to the top of mind as of late. Right now, the managed care organizations with Medicaid, they're allowed in many states to reimburse for less than that traditional fee-for-service Medicaid. And so this reimbursement rate's really, lower than people would like. And so there have been bills introduced in New York, Missouri, Indiana, and then Minnesota actually has one as well. And this would ensure that the MCOs can reimburse for O&P at the same level as fee-for-service Medicaid, which is very helpful. And I think it allows for a lot more, equity when it comes to providing care. And then I think just the last thing would be involving cranial remolding orthoses, which are, for those who are listening who might not know, they're just the helmets that help correct infants' head shapes. A lot of state Medicaid programs deem these to be kind of cosmetic and not completely medically necessary. But AOPA has a CRO work group that has come together fairly recently to meet to talk about how to make sure that these are covered properly and reimbursed properly in Medicaid offices. We actually were approached by North Carolina Medicaid a few years ago proactively, and they basically said, hey, we'd like to align our coverage standards with the most up-to-date kind of clinical policy. And so the work group and Medicaid, we kind of met and were able to collaborate for the span of about a year to make this policy as strong as possible. And it's just being implemented now. And now we have kind of a blueprint to bring to other state Medicaid offices to increase that coverage and reimbursement as well. So I think those are kind of the main state level initiatives that I can think of aside from so everybody can move, obviously.
Yeah. Well, it highlights, I think something really important too, both for the so everybody can move initiative and then these other ones, is that when something starts at a state level and it's successful and has a really strong blueprint, it's really easy to get easy, air quotes around that for listeners, easy to get other states to kind of adapt or adopt similar language to their pre-existing laws. And there is such a variance state by state that sometimes people don't realize. And so it is really good when there is more cohesive verbiage across the board, I would say, especially in like kind of the semi-remote hybrid world we live in. You move out of one state to another state and all of a sudden you realize, why am I being denied for this by my insurance? And before I wasn't. It's because you're in a different state. Things have changed.
Absolutely. And I think that's a really cool part of a lot of these initiatives is being able to show our community, the O&P community, that we are stronger when we work on these things together. And as part of So Everybody Can Move, we've been doing bi-monthly lead advocate calls where all of our leads from the various states come together to share best practices and knowledge. And it's been amazing to see, how much that has propelled individuals to either decide like, hey, I could actually lead this in my state, or to feel supported or to find answers. Just recently at the Academy meeting, we were able to hold a mixer and have a lot of our lead advocates come together and meet one another. And one of the advocates came up to me and was just, very excited about a new idea that had been shared to potentially find a way to get a lobbyist in their state. So, I mean, it's just amazing to see kind of the knowledge sharing and
what can be done when we all work together versus feeling like, we're having to be separate on a state by state basis. So,
well, and I think you hit the nail on the head with that, because I mean, when you look at these, you think maybe some of these initiatives are so large, and how can we make a difference? And it truly is, eating one bite of the elephant at a time. And you guys have done such a good job of getting people to see the success and want to join. And I think there's, an overwhelming sense of pride when you do get involved and you see it come to fruition. But what can, the listeners and, all the different practitioners and patients alike in the O&P world do to join up and help?
Yeah, what's the blueprint?
Yeah, well, for So Everybody Can Move, I would love to encourage everyone to go to soeverybodycanmove.org. And this is a way for you to find out exactly what's happening in your state. We have an interactive map on there, so you can go in, click on your state, see what's happening. You can also sign up to become an advocate by filling out a form. You can reach out to us with various questions. But I also want to highlight on that website that we have a tab for resources. And what we've been doing is taking all of these best practices and knowledge learned and compiling them in a way that we can share all of this knowledge. So we have a advocacy and lobbying toolkit that states can take up and use in their own state, policy brief so that they understand the issue on, the history of why orthotics and prosthetics for physical activity haven't been covered and why it's necessary that they will be covered. We were chatting earlier about the economic argument for this, and the same thing for the Medicare O&P Patient-Centered Care Act is exactly the same for So Everybody Can Move. Mobility saves money in the long run, and the upfront minimal investment that, insurance companies would have to provide for orthotic and prosthetic care for physical activity over the long run is going to pay for itself by getting people physically active and preventing diabetes and heart disease and obesity and all of that. So we've got all of that information in our resources tab, the model legislation, our brand guidelines, fiscal impact assessments. So I want to encourage people to go in there, dive into all of that information. And if you're interested, becoming part of our lead advocate team and joining us on these bi-monthly calls. And then one thing I also want to plug as a little thing for the future, in July, we're going to be hosting our first ever virtual mobility challenge, which we're calling the 28 by 28 Mobility Challenge for So Everybody Can Move. And the reason it's called 28 by 28 is that is our ultimate vision and goal as part of So Everybody Can Move, is to get 28 states to enact this legislation by the 2028 Los Angeles Paralympics. So the Paralympics are coming to U.S. soil, and we've seen in other countries that there's incredible synergy around having the Paralympics in one's country and being able to make a policy change in relation to orthotics and prosthetics for physical activity. So 28 by 28 is our goal. We're going to have a month-long mobility challenge in July where people can sign up, register, start getting active and helping to fundraise to, give back to this movement and really celebrate the accomplishments that our advocates are achieving across the country. So yeah, we're looking forward to sharing more information on that, but soeverybodycanmove.org.
And it's all about awareness. So anyone listening, spread the word.
Yep. In terms of spreading the awareness, we would love that. We're seeing some incredible awareness being spread on social media, and you can follow us at So Everybody Can Move on Instagram, is where we're at right now.
And then on the federal side of things, we also have, I'm plugging another website. It's AOPAvotes.org. This has letter writing campaign. You can fill out a short form and it automatically sends messages to your members of Congress, your representative, as well as both your senators. And so that the Senate bill actually was just introduced a few days ago. So we're really trying to push that as hard as possible now that policy forum is just about a month away. And then in terms of other state initiatives, I have a video series called the State Policy Forecast that we post on AOPA's socials every month. And this covers both So Everybody Can Move and also other policy kind of initiatives, legislation, regulation, all of those types of things. So if you want to get involved in that, you can also reach out to me or advocacy@aopanet.org to get involved in any of these initiatives.
I don't know if you guys were aware, but on March 20th, California O&P Association held a rally at the steps of the Capitol, and we had over 100 attendees come, and we had local news coverage. They had a drone capturing all the footage. And like you said earlier, it's all about awareness, and people want to help in these initiatives. There's such a benefit to it all. And I think if we just have the confidence that, yes, I individually can help in some way, and even if it's just spreading awareness through social media, I mean, how simple is that? Or voting, like you're saying, at the AOPA vote site. I mean, these are little things that we can do as individuals. So anyway, I just want to say we can make a difference.
Yeah, no, it's so true though. I always think like this is a small industry, and just even having conversations with friends and family, no matter what you do in the industry, brings so much awareness to the industry. The number of people who go, oh yeah, I work in O&P, forgetting that like we know what O&P means, but they don't even know what O&P means. Like, oh, it's orthotics and prosthetics. Like, oh, well, what does that mean? Like, okay, well, have you broken a foot and they put you in a little boot? That's an orthotic device. Like, it affects so many more people than you realize. So just having conversations with friends and family is meaningful and impactful. So that's one thing that's been cool to kind of learn as I'm growing in the industry, to kind of see that just talking about what you do is really impactful in a lot of ways.
Absolutely. I couldn't agree more with that.
Nicole, I'll give you a special shout out too. I remember back in 2022, you had a phrase that has stuck with me. And I always, when people ask what I do, I talk about how, we provide mobility and empower people to, move forward. And your line was movement therapy. And I use that all the time. Just imagine you didn't have the personal therapy coming from just your everyday movement and exercise and all of that. And it really sticks with people.
Yeah, absolutely. I mean, this is something that anyone and everyone can relate to because we all need movement in order to be healthy, and mobility is part of our everyday lives. So, whether someone works in orthotics and prosthetics, they can relate to the work that we do because, we're empowering human potential. We're getting people back up and moving and being able to receive all of the benefits that come from that. This isn't just a physical thing, it's a social, emotional, mental part that is all built into mobility and what it allows us to do in our lives. So I think that's such a great point, Jackie, that we have to make sure that, one of the phrases that Sam and I have been using with So Everybody Can Move is leave no stone unturned. Like there are so many people out there that care about this cause and that we can get on our side. So it's not just thinking about our healthcare professionals, but our family, our friends, anyone out there who cares about people with disabilities and cares about mobility. So.
And I'd just like to say too, I know like sometimes people hear Medicare, Medicaid, and they're like, oh, well, I'm not in that category. But I love that you guys talked about the insurance fairness laws, because that impacts everybody. Like, no, maybe you're not on Medicare, Medicaid, but like you're probably on some type of insurance plan somewhere. And that does impact you, making sure your insurance providers are also giving you equal and fair access to what you need is just as important as Medicare and Medicaid. Just Medicare, Medicaid might be the starting point for some of those things. So that's one thing that I really like talking with you guys and learning in the industry is like, no, this all like connects together. This impacts everybody on all scales, not just an O&P. It's across the board.
Yep, absolutely. That's kind of our strategy with 28 by 28 as well. State by state, but once we can get past 25 states, we can then go towards a national federal bill. Unfortunately, in the US, our insurance system is so piecemeal, and we're trying to get as many people covered as we can. But bit by bit that we're getting that, and we're setting precedent, and we're getting to the point where we could have something on a national scale.
And is that like a hard and finite number? And I don't know politics nearly as well as you guys do. As soon as you hit 28, does that allow you to apply for a federal?
It's not necessarily a hard and fast rule, but I think legislators like to see more than half of the states that have enacted a bill to show that there is, generally widespread support and momentum on something.
Very cool. Well, you guys are doing awesome work, and thank you so much for taking time out of your day to speak with us.
Absolutely.
Yes. This has been great. Like, we've covered a lot. So is there anything else that you guys want to give a shout out to, draw attention to? Like, the floor is yours. This is your moment. If there's anything you haven't talked about.
One thing I would want to just share and a shout out in terms of from the So Everybody Can Move standpoint is that the momentum that we're seeing would not be possible without all of our advocates on the ground, all of the state associations and coalitions that are being built, but then also this incredible partnership that we've created at the national level. So Everybody Can Move is not only being led by AOPA, but also our partner organizations, the Amputee Coalition, the American Academy of Orthotists and Prosthetists, and then also the National Association for the Advancement of Orthotics and Prosthetics. And having that type of collaboration at the national level where we're all working together towards something has been just instrumental for this movement being able to take off in the way that it has. And so I just want to give kudos and shout out to the way that our industry is coming together on this initiative. And for you guys, thanks to you guys for having us on to be able to increase awareness on that as well. Every player in this community has a part to be able to help advance this cause. So thank you.
Yeah, absolutely. Could not have said that better. That was pretty much exactly what I was going to say. So that's well said, Nicole.
All right. Well, if you would like to learn more about AOPA's advocacy efforts or connect with Nicole and Sam on LinkedIn, we're going to drop all the links in our show notes. You can go follow them there. So go click on those links. Go check it out, guys. This is important work. And thank you, Sam and Nicole, so much for joining us today. This has been awesome.
Thank you guys so much for having us.
Thank you so much.
Thank you for tuning in to the O&P Check-in, an SPS podcast.
If you haven't already, be sure to subscribe to the show on Spotify, Apple Podcasts, or wherever you listen to episodes.
And while you're at it, rate and review the podcast to help fellow O&P professionals find us.
Email us your topic suggestions and feedback at spspodcast@spsco.com.
See you next time.